My name is Jaspreet Saini. I'm a GP and I've been working as a GP for the last 10 years. I work in West Pennant Hills and in Rooty Hill in New South Wales. Started off my career as a medical student in Monash University and spent 5 years there and moved across to Blacktown Hospital in New South Wales, where I did a few years as an intern, followed by my residency years. From there, was really interested in a variety of things in medicine and didn't really want to constrain myself into one role, so I decided to do general practice. Jumping into general practice, realised the frustrations that that patients and GPs have with their healthcare system and the importance of multidisciplinary care. And part of my career journey was travelling to the United States as part of a group to understand how they practice medicine there and the models of care in some of their best areas, but also in some of the areas that are more underserved. Realised that there was a lot of potential in primary care in Australia and decided that I needed to take the leap and go into practice ownership. 2019, my wife and I bought a practice in West Pennant Hills, which we still have, which we've built up in terms of our care philosophy, and we've built up digitally as well. Excited that practice has now gone on to win multiple awards. Realising then that part of the impact that I wanted to have that I wasn't quite having in West Pennant Hills was working in a more underserved community and helping to address the health equity issues in Australia. Jumped into a role in a clinic in Rooty Hill, and I've been here since February of this year, very much about redesigning the way healthcare is delivered in this area. The demographics of patients that come to both practices, the one in West Pennant Hills is very much serving a more health literate community, people that are very interested in their health and well-being and are quite informed and educated about what it is that's going to have a positive impact on their health as well. Reasonably more affluent than the other practice that I work at, and community that's much more resourceful and generally more engaged in the healthcare system. In comparison, the practice in Rooty Hill is an area where traditionally it's been considered to be an area of lower socioeconomic status, and potentially an area where there are much more difficulties in accessing healthcare as well. We understand that Western Sydney, particularly the area that I work in Rooty Hill, has higher rates of obesity, diabetes, and other chronic conditions. We understand that accessing healthcare is a lot more difficult in this area, and people have to wait for long periods of time to get the healthcare that they need. So you can see that there are quite significant differences between the two practice areas. My typical work week has evolved significantly. It started off being full-time clinical practice, seeing patients from essentially 8 a.m. in the morning to 6 p.m. at night. Now there's a lot more leadership and management involved. For example, 3 of my days are dedicated to helping coach and lead healthcare teams and working quite closely with clinicians, whether that be GPs, nurses, a medical practice assistant, to help them understand how they can best deliver care and how they can essentially untap their potential as clinicians as well. That's one of the roles. The other part of the role is also getting involved in research, whether it's research around health equity, whether it's research around models of care. Writing research papers, applying for research grants tends to be a significant part of my week as well. The other part of the week is interacting with people, potential partners, speaking with philanthropists, and helping my practice in Rooty Hill grow by sourcing non-Medicare sources of funds. What we've realised over time is that healthcare, when done in silos, doesn't work really well, and that a partnership or collaborative approach is really important. What we do is partner with a key group of organisations in the community on a variety of projects. So, for example, in Rooty Hill, we're working with the Western Sydney Diabetes team, which includes an endocrinologist and a dietitian and a diabetes educator, as well as a dietitian and exercise physiologist. We are incredibly proactive in our care. We scrutinise the practice data, understand which of our patients have diabetes, and rather than waiting for them to come into the consult room, we proactively call them and bring them into the practice. We wrap care around them, we respond to their needs and make sure that their chronic conditions are as well managed as possible. We understand that if a GP was to do that work on her own or his own, that it would be incredibly inefficient and ineffective. And the only way that we can really provide good care is by bringing teams together. We're about to launch an obesity clinic or a metabolic clinic later this year, recognising that one of the key issues in our area is obesity, and that obesity, there's a lot of stigma attached. Often people don't really have the understanding necessary to manage it on their own. And again, a partnership or team-based approach becomes really important. So excited to launch that. And we're looking at other needs for the community and responding to those needs as well. GP workforce is a significant issue. We understand that by 2030 there's an estimated 11,000 GP shortage, and that means that there will be a huge inequity issue in Australia. Increasingly, what I see personally is that GPs are moving more and more into areas that are reasonably well off, where they, for example, can charge a gap and provide quality care in line with their vision and values, in an environment where they're appropriately remunerated for that care. One of the drivers of that change is that the rebate for GPs or rebate for accessing GPs has not increased in over 30 years. And over time has actually decreased in proportion to the CPI. So you've got a workforce that is trying their best with constrained resources, and a population in Australia that has an increasing divide between those that have access to healthcare and those that don't. Part of the reason for building the clinic in Rooty Hill was to address that challenge, and part of why I've mentioned the idea of non-Medicare funding and the importance of getting creative around funding sources is to help attract GPs into areas like Rooty Hill, which absolutely have higher need, but aren't quite served well enough by the existing Medicare model.